Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with right-sided otitis externa. Otitis externa is an umbrella term given to an infection and or inflammation which involves the outer ear. And the outer ear consists of the pinna, which is the flap of cartilage that we have on either side of our heads that looks like a satellite dish. The ear canal itself, which is medically known as the external auditory meatus, and we often abbreviate that in clinic, in our clinical notes, as EAM. And also the outermost layer of the eardrum. So the eardrum is 3 layers thick. The outermost layer, which is facing us, the lateral layer, that's formed of the epidermis skin, so the outermost layer of skin which lines the inner 2/3 of the ear canal. It also consists of a middle layer made up of fibrous tissue, and the fibrous tissue is aligned in 2 ways, at least in terms of the pars tensor. So the pars tensor is the main body of the eardrum, and the top part of the eardrum, which hopefully I'll show you once I've cleared this debris, we call that the pars flaccida. And in the pars tensor, so the main body, this fibrous tissue is aligned both concentrically, so almost like a spider's web, and they're interconnected. You've got these radial alignment as well, so it's what gives the eardrum its strength and rigidity. In the pars flaccida, you do have fibrous tissue, but it's more diffuse, so that part of the eardrum is a bit weaker, hence the name pars flaccida. And then the innermost layer of the eardrum is made up of the mucosal membrane, which also aligns the rest of the middle ear, the eustachian tube. And so you can think about the mucosal skin being similar to the skin that lines the inside of your nose. It's more moist and wet and secretory. So whenever you've got an infection or inflammation of one or more of these parts of the outer ear, we call that an otitis externa. And there's different types of otitis externa. So you can get superficial otitis externa, where it's just affecting probably the most outer layer of skin, the epidermis layer, and quite often with that you don't really get any inflammation. You may get itchiness of the ear and a bit erythema, but here we have got some edema. So when you've got some edema, some swelling, and you can see it's quite red and it's inflamed, we know it's probably affecting, so the inner 2/3 of the ear canal. As I said, we've only got the epidermis layer of skin, the outermost layer of skin. It's absent of the dermis layer, the middle layer, and the subcutaneous layer. But in the outer third, you have got the full 3 layers of the skin. So when you've got edema, quite often it can affect also the dermis layer. So it's more than just superficial for that reason. And when I used to have a German Shepherd, God bless her soul, so my little baby, and German Shepherds had a genetic predisposed condition called German Shepherd pyoderma. So they would also be very prone to developing dermatitis, so infections and inflammation of the skin. And the vet would always classify it as either being superficial or deep German Shepherd pyoderma. And when it was deep German Shepherd pyoderma, it would look like this. It'd be quite red and inflamed. You can, of course, call it acute otitis externa. Other names, you can then give it grading systems like mild or moderate or severe. So this is definitely not superficial. It's just not on the surface of the skin. It's a bit deeper than that. The patient has been seen by their GP. They've been prescribed oral antibiotics, and they obviously haven't responded to that. They've had 2 courses of this, and normally when you've got an outer ear infection, it's, unless there's any contraindication, so there's a perforation, for example, or previous allergies to any topical antibiotics provided, topical is probably the best way about dealing with this infection, because it kind of strikes the source of the infection. When you have oral, obviously it's more systematic, it goes to the bloodstream, whereas this is more targeted. So we've written to the GP, and hopefully they've been prescribed some topical. They haven't responded, as I said, to the oral antibiotics. You've got to be careful as well, because if you prescribe antibiotics, the patient can also develop a secondary fungal infection. So what we're trying to do here is just peel away as much of this debris. The skin's very macerated, as you can see, it's broken, this epidermis layer. Whenever the skin is inflamed, it's more tender, so we're more likely to cause trauma. So that skin is more delicate, and the last thing we want to do is cut the skin and cause more trauma, which can then, of course, exacerbate their infections. We're very, very gentle. I just want to get this macerated, soft, dead layer of skin away. I'm just gliding across the surface. This patient's ear canal is a bit longer than the average ear canal length. So the average ear canal length from the entrance to the eardrum is approximately 26 millimeters, but that can vary, of course. Children, it's going to be shorter. Male ear canals are longer. And there's individual differences between males and adults. So amongst those populations, so I would say this is a bit long, probably, I'm not 100% sure, but more approaching 30 millimeters. So it's a bit difficult to get access, and you can see how I've just curled the tip of this fine end. I want to avoid the front part of the ear canal. So I'm using the fine end here, and there's just some dead skin on the eardrum, just peeling it away. The more debris that I can get away for this patient, the more likely any topical drops they're going to be prescribed is going to be more beneficial, because it's going to be making contact with the surface of the skin, and then it allows a better opportunity for it to penetrate and be absorbed, to help fight any infection more deeper in the deeper layers of the skin. It's not always possible though, because of course they're attending with an infection, so the ear's going to be tender, it's going to be a bit painful, so you just have to judge it. Obviously patients have different tolerances, some patients are more sensitive than others, so you've got to think about the ear anatomically, but also the patient and how they respond to you performing the procedure. Now, I know there's going to be a lot of pharmacists that are going to be watching, and that's because in the UK there's a new initiative called Pharmacy First, where from the 1st of February, I believe, if you're a pharmacist, it's a government initiative because of the big waiting list, but they are able to treat and diagnose 7 certain pathologies and different disciplines, and one of those is ear infections. What just slightly concerns me is I've got friends who are pharmacists, and they're saying that all their training is just delivered online in modules. It's not even mandatory. It's up to the pharmacists themselves to decide their own level of competency. And although they are face-to-face otoscopy sessions, if one wishes, again, it's not mandatory. And I had a pharmacy colleague attend the clinic. He's a patient of mine, and he's very concerned because he's never held an otoscope before. He suffers from hearing loss himself, so he knows how precious and delicate our ears are. So it's a bit worrying. I think pharmacists have got a role, but of course, like with any profession, you need the adequate training. So that's my only concern. So hopefully that was beneficial, that video. So take care, guys. Speak soon.